associate myself with the comments from Senator Thune with respect to the process. I think this looks like maybe the only hearing we're likely to have an opportunity where this committee can engage in a public forum to discuss what are the sweeping policy changes and massive expansion of government that Democrats have embarked upon. And I think it should be noted that even for bills that resulted in a partisan outcome, this committee has always followed regular order, debated and voted on amendments. And I think it's a shame that after promises of bipartisanship and cooperation, even here today, we are facing policies that are fundamentally changing the tax code, affecting the economy, and the way consumers access health care coverage on a completely partisan basis. The American public ought to be included in that conversation, and that to me suggests we ought to be having a process that includes regular order hearings and a markup. Based on that recent CBO letter that Senator Thune referred to about the House version of the Democrats' tax and spending spree, we now know that the proposed coverage provisions would cost more than $500 billion to cover about 4 million people over 10 years. The CBO also predicts this means that 2.8 million Americans are going to lose their job-based coverage, which sounds like another, if you like your health care plan, you can keep it falsehood. Dr. Holzeken, could you talk about what drives this shift away from private coverage into plans heavily subsidized by the federal government, and what does it mean for the long term?
This has been a concern since the ACA was passed. If you ran the numbers, the subsidies were already so rich that for anyone up to about 300% of the federal poverty line, the employer could stop offering coverage, put the individual into the exchange, give them a raise, and make more money. So the bottom line is there was so much money on the table in the exchanges that it was really in the incentive of employers to stop offering coverage. This is an increase in those premium tax credits, and we're just seeing the same behavior in the CBO estimates. They've been watching this carefully, and there are clear incentives for employers to stop offering insurance and in the process pay their workers more and make more money simultaneously.
Does the Democrats' proposal to make the expanded ACA tax subsidies permanent include anything to prevent exchange premiums from increasing? In other words, if insurers increase premiums, do the taxpayer-funded subsidies keep increasing too? And what does that mean long term?
The answer is yes. I mean, that's how these subsidies are calculated. And this is the concern I have about the discussion exclusively about access and coverage. In the end, insurance is a financial product to shift the medical bill around. The real problem is our national medical bill is too big and delivers too low quality care. So getting control of the bill allows you to keep insurance premiums down directly and doesn't require as much taxpayer subsidy. So I think the sustainability issue that was raised by Senator Cassidy, this is right where it hits.
Okay. And just as a quick follow-up, is it correct that these expanded taxpayer-funded subsidies could fund plans that cover elective abortions?
Yes.
Yeah, and that's, again, a violation of policy that's been in place literally since, for 50 years, since the early 1980s. This year, the administration allowed special enrollment periods on the exchanges that lasted more than 6 months. The Democrats are now proposing to create a continuous enrollment period for individuals at certain income thresholds through 2024. For years, we've heard about issues with adverse selection in the insurance market. So what's changed?
Nothing. Our analysis indicates the special enrollment periods will raise premiums because of the adverse selection issue, and that will make this program more expensive on top of everything else.
Let me shift gears for just a minute. And I think Senator Thune covered well what the Medicare trustees have told us about the insolvency being faced by the program in 2026 and the question of dramatically expanding some of these fee-for-service program benefits to, and what that's going to mean long-term in terms of the financial viability of Medicare more generally. But I want to ask you about your past experience as CBO director, and just ask if you could perhaps provide some context to the CBO report recently about federal revenues for the first time hitting $4 trillion. and increasing individual income taxes is a 27.5%, 80% of that coming from the top 10% of earners. Corporate rate income taxes rose 75% to $370 billion. With revenues coming in at historically high levels, what would be the fiscal or economic impacts of raising taxes on American workers and businesses?
The impact on the economy is decidedly negative. We're recovering well from the near-term losses due to the pandemic. We still have a long-term growth problem. The proposals that are on the table would inhibit the accumulation of intellectual property, capital, and other productivity-enhancing investments, and that would be negative over the long term for productivity, real wages, and the standard of living.
Okay.